Hello everyone, welcome to another video with Chiro Movement Muscle and Joint Clinic. I'm Dr. Bird. Today we are showing what we look at when we're looking at the knee for someone that comes in with a knee injury or knee complaint. The biggest part that helps me out is your history. Telling me what you have had going on, when you're having pain. Is it certain motions, is it certain parts of a lift, is it with walking up or down stairs, things like that. When we're showing these tests, they are a guide for us to help figure out what we're doing with. They are a guide to help us direct a treatment plan for you. So we want to show just a real brief assessment of the knee. We'll kind of talk through it a little bit more as if I'm talking to her and what we're doing and what we're looking for. So I hope you enjoy this, and if you have any questions, then please let us know. So orthopedic exam of the knee involves both just looking at knee observation. Is there bruising, swelling? Is there redness somewhere? Does it look like it's in place comparatively to the side that may not necessarily hurt? So do those patella sit relatively in the same area? Do they move at that same distance from each other? What is that mobility like in the patella? Can it move up, down, both lateral and medial? And is it excessive, or is it within a good, normal, controlled amount? Okay. In the knee, we are looking at the anterior drawer test is for the ACL, and we're going to hook behind the knee, behind the tibia, and pull. We're looking for a gapping or a laxity in that knee. Same thing with posterior drawer, seeing if that moves. Those are meant to be very strong, stable ligaments, right? So anterior drawer, posterior drawer. From there, looking at both trying to compress the outside of the meniscus or pulling on the ligaments on the inside of the knee, the MCL. You're going through and putting a valgus stress to that knee and then dropping through. We're looking for clicking in that knee as we go through. We may do it 2 or 3 times to assess just the motion of it. And then same concepts here, trying to create a varus stress, meaning pushing that way to compress the meniscus on this side, on the inside, and stress that LCL over here. Same concepts there. Again, we may do this a couple times. We may just check flexion and extension. And what does it feel like when we go full end range extension there? Or what does it feel like when we're end range flexion there? We add one in that comes from the FRC group that talks about the internal and external rotation of the tibia. Now what we're doing is very passive. But it should have some give as we passively move it in both directions. Okay? When we're looking at a possible knee osteoarthritis of like the patella, the kneecap, we're going to do a couple where we're actually going to compress that kneecap into the knee itself underneath it and check for tenderness. Even move that around with a little compression, see if it's grinding. Looking for chondromalacia patella. It's a softening of the cartilage underneath the patella. And then one test is called Clark's test. I'm going to take my hand like a C shape and put it at the top of that patella and compress down and have you contract your quad. And we're looking for that grinding again here and seeing, is that painful, right? Will you sit and face this way? When we're looking at patellar tracking, we want to see just the motion of the patella itself. Does it seem to deviate left or right as you go from flexion to extension? Those should stay in a general alignment with each other, right? Same concept, other side. And you get a little clicking on that outside of it. That is the assessment of the knee joint itself from both the laying up, face up position and sitting. There's a couple more tests you can do when you're laying face down for distraction. We'll show you that real quick. Lay face down. from this position, we will hold down the leg femur and lift while the foot is internally rotated, and lift, and then switch directions, hold, and lift. We're checking for just that. Does it create any sort of sensitivity in the knee on the ligaments? And then we'll compress. Okay. From there, we would do our functional movement screen, movements like the 6-inch step down test, a squat, a lunge, even a jump, side steps, all those other things to see what may trigger knee pain for the patient. So that is our testing. If you have any questions off that, please let us know. Again, what this tells us is what we need to do from here, what your treatment plan may look like, and it helps give us a guide and a baseline of these tests were positive, meaning they created pain or provocated pain to the point where it's like that becomes something that shouldn't be there in a normal, healthy, functioning knee, and we use that as our baseline. So, hope you enjoyed. If you have questions, let us know. Thank you for watching, and if you'd like, please hit that subscribe button thing and the like button, because we like that too.